Would you like to have control over your life, especially the end? This control can be the difference between suffering and peace. We all believe that all of our choices are ours to make, but for our patients with terminal illnesses, these choices are often limited through suffering. When researching physician-assisted suicide, I discovered that this topic is a very complex one. It addresses both medical ethics and empowering patients' rights. We should consider the perspective of patients and look at the compassionate options for those with terminal illnesses. Through talking about physician-assisted suicides, you can raise awareness that help educate others, leading to a society that values patients' rights. In the next few minutes, I would like to discuss the ethics of physician-assisted suicides, how physician-suicide supports patients through alleviating suffering, respecting their rights, and changes a doctor's role. In this speech, I will abbreviate physician-assisted suicides to PAS. Oftentimes, there are many patients that suffer through chronic and terminal conditions. These patients experience constant pain every day. PAS would minimize the suffering and create more respect for the patient's dignity. PAS often offers humane end-of-life care. Currently, the law allows for pain medications that will help the patient but hastens death. This shows how society has already accepted death as a potential consequence in medical care. There have also been surveys that show results that people prefer quality of life over the longevity of life, which is what PAS aligns with. The patient's rights and autonomy is crucial in healthcare. Everyone should be granted the individual right to create informed decisions about their own body. PAS allows for people to make their own decisions at the end of their life. Allowing these discussions creates a more moral approach to healthcare and allows for patient preferences to be respected. A quote from J.S. Mill's Principle of Liberty: "Over himself, over his own body and mind, the individual is sovereign." PAS would change the doctor's position. PAS laws would make the doctor's purpose to the patient's quality of life over quantity. There have been surveys that result in support from physicians for patients requesting PAS. Dying can be part of a doctor's role as acting in the best interest for the patient. Oftentimes, these laws require a verification process to ensure PAS requests are beneficent for the patient. The focus of doctors' care would be more individualized, creating a more personal connection between the physician and patient. In this speech, we have taken a look at the ethics of PAS laws and how these laws would protect patients' rights, health, and doctors' role. I spoke today to create a push for more educational and information about PAS laws and their terminal patients' options. When a person hits an animal on the side of the road, most people check on the animal if the animal is beyond saving, but still in pain most of the time. But if the animal is still in pain, most of the time the driver will kill the animal, and people consider this a mercy. However, we are not animals, and some terminal patients believe that death is still their mercy. We may not be able to resolve all pain and get rid of the stigma around physician-assisted suicide. However, educating others through open discussions will create significant differences.